Yes sir, start कीजिए आप.
Okay. So, good evening, friends. Dr. Gajanan V Dhanipkar. As a prelude to the upcoming course of managing acute conditions with homeopathy, I would like to share what this journey, which is going to be for those next 7 days, would be like. I have always wondered what is the most satisfying in our practice. What is the thing that gives us the ultimate joy in prescribing? And what is always that the patient has expected out of you? And it has been always results. A patient coming and telling us that your medicine and the first dose that you gave had made me tremendously better. I feel excellent after the remedy. And what if your first dose that you give relieves the patient in the clinic itself from his most agonizing pains or his most severe breathlessness? Nothing is more satisfying this for you, me, or for that matter anybody. This is the basic key to success in practice. All this and more has been written in our old books by our masters in the words of gold. But the problem is how to decipher it. And this whole journey would be just understanding how to decipher our old masters. Their words that they are written in gold, which make the patient better like magic. Basically, I come from a school where I was a complete non-believer of homeopathy. And once I entered this, what was convincing most was the results which happened much faster and many a times like a magic with one dose which transformed the patient. There are different ways to approach acute condition. There are some cases which make you go head and shoulders above the rest when you give dramatic results. I just remember a few of my cases in my practice. It was a late evening when I was called for an emergency visit to see a patient with severe cancer pains in the most terminal stage. I went to his house, and when I went in, what I saw was tremendously aghast. This patient had an oral tumor which had perforated his orbits, the eyeballs had dropped out, and was in agonizing pain. He had already taken 3 shots of morphine, and they had expected me to give him relief after that. There was no possibility of a case taking because this patient couldn't even tolerate a drop of hat or a pin. That noise was also so irritating to him. When I asked him a question, he just waved a hand and said, "No, don't ask me anything." I was just scanning his reports from the medical college, and I found a very good entry to the case where the allopath was examining him had written the primaries as a cancer of the hard palate. With this information and nothing else, I just opened my books to see from Fatak's repertory. And cancer of hard palate, the only remedy was hydrastis. We gave him hydrastis, and within just few hours, maybe just 12 hours, the patient's relatives rang up saying that he's much better. Now, he's actually listening to music. This patient survived for next 6 months uneventfully, where the worst took him over. But the relief which hydrastis gave and the quality of life that he had was exemplary good. There are many such cases. where you need your good observation, your clinico-pathological correlation, which is much more than taking the symptoms and the case. What you observe, how you correlate the pathological condition, the sphere of action of the remedy, and give dramatic results. A woman walks into my clinic talking about increased frequency of urination. Of course, she had many modalities. They were taken for repertorization. I examined her and found that there was something hard that was pressing in her lower abdomen. To my confirmation, it was a huge fibroid that was pressing over the bladder. Now, it was a mechanical obstruction that was causing these pressure symptoms, causing her to have this increased frequency. While reading one remedy, I had read about uterine pathologies pressing about the bladder, causing urinary frequencies. The remedy that was Solidago. After giving Solidago, first change was the frequency which she had stopped. The size of the bladder reduced, size of the tumor reduced, and she had a complete relief. What was this? This was something which is written in the Materia Medica, oblivious to our eyes. These are treasures which we all need to know, hidden somewhere. Many a times, your acutes can be a window to the constitutional remedy. And your observation, the skill of observation, helps you to understand the case much confirmatory, because in an acute situation, it is a crystallization of the state that has just come up in front of you. It's up to you to pick it up, and it is the skill of the homeopath. And that is what is the whole course going to be about. This child who was brought to me was a case of ADHD and had a typical mania. He was, of course, destructive and had all kind of disturbing symptoms. But he had a mania of clapping the hands. And I was continuously observing this, that this child is continuously going on clapping his hands in the clinic. And the father pointed out that he takes up this every time and it's very irritating. I opened the repertory and the only remedy for clapping the hands, maniacal, the remedy was stramonium. And then the rest all just joins together, conspires exactly to give you a complete case. Everything fitted well, and stramonium relieved him of ADHD. Another case of a similar type, patient with another maniac disorder. Generally, we do such a huge case taking, but how your acute observation skills, which are not given in the books, which you learn from your gurus by the Guru Shishya tradition. This guy comes in, stands next to me, and says, "You're taller than me." Says, "Look at this." She goes to the next assistant and says, "She's also taller. Why I am short?" And the mother started telling me that this is a new thing that he has come up with last so many months. He goes down the street, stands next to people and sees how tall that person is. And he's terribly upset if he sees somebody who's taller than him. So there was huge area of symptoms that were pointing to so many things. And I was just focusing on this particular aspect, which was most predominant in the case at that time. I looked up the repertory to find the only remedy there was lac canine. And rest everything fitted, the animal kingdom, the anger and everything fitted. So how your acute case taking becomes many a times a window to your constitutional remedy. Now, understanding the change, the physiology. This is the most important aspect of case taking in acute conditions. See, we have so many people walking on with headaches, migraines, and how far that you have relieved the patient immediately after giving the remedy. And this is most important. If you can do this in your practice is going to go sky high. A young homeopath, she walked to me with a severe headache. She had already taken many remedies. And it was a time when the rainy season in our subcontinent was about to get over and the sun had just shined. I asked her all the modalities and she gave me all the modalities which were typically of glonine. The sun aggravation and the bursting headaches and everything. I asked her, tell me exactly when it started. She says, the moment the sun has started coming up, the moment so many days which were so rainy and cloudy, I was okay. The day the sun started coming up, my headache has started. If you look up Boric, it is written very wonderfully in the Materia Medica. Onset of headache with the onset of summer. And the only remedy that was indicated was natrum carb. And one dose relieved her within just few hours or few minutes, in fact. So many magical cures which can happen with homeopathy. Why go so far away? What is the today's situation of COVID? What had it to learn? What it has taught us? In all COVID cases, what a homeopath nowadays is doing, and in fact, when there's an active COVID case, in this time we could see around nearly more than 400 cases of active COVID disease with me and my team. And we could give good results, and the mantra to that was the acute case taking. There was one patient who called me late at night on a video where this patient was having fever which was not responding for last 4 days. Patient was tachypneic, as you know what happens in COVID. And in the video, when the patient was giving the history, he was extremely exhausted, couldn't speak much, but he was continuously lying like this and talking. So any position which a patient adapts in the condition becomes very important. The only question that I had to ask her is why she was lying like that. And the answer was the entry to the case, the anchor in the case. She said, the moment I lay the chin down, it chokes. I can't breathe then. I can't keep my chin to the throat, to the chest. It's very choking. So I'm just sitting like this with the head extended. This actually blew my sleep out. I looked up the repertory and I had only few confirmatory questions. As what is stressing you the most right now? She says, my fever is not stressing me the most, but my husband, who's COVID positive and in the hospital, my daughter, she's COVID positive in the hospital, their health and thinking about them has made me terribly exhausted. I asked her, would you like to drink anything? And she said, maybe a juice would do. And that was just confirmatory of acid fast. Because choking on flexing the neck, the only remedy is acid fast. Magically, she improved within a day. So many dramatic cases where you can see results like crazy. Yesterday, a girl calls me and saying, I am having severe dysmenorrhea. Now, dysmenorrhea is such a thing that if you relieve with a single dose, the patient can be your fan forever. I asked her, tell me anything else that happens which you feel is not associated with. And she said, sir, actually, whenever I get this, I get pain in my nipples. I said, tell me again. She said, I get pain in my nipples. It was very peculiar. And I looked up the repertory. The only remedy that was mentioned was Helonius. A dose of Helonius completely relieved this patient. So, these magical cures are not something which happens by accident. They are something which are given in our materia medica, in our repertories, and how to decipher that. So the whole 7 days will be a journey to understand the materia medica, the repertory, the art of understanding the patient in the acute approach a case, how to see conditions of different systemic problems. Maybe it's a respiratory system that gets affected, your articular pains, how to relieve a patient, especially in joint pains, and that too instantly. In gynecological problems, how to stop the menorrhagias, and you know how painful it is for a homeopath to stop the menorrhagia when a patient tells you that she is bleeding for many days. How to use different approaches, how to use different repertories, how to use the sphere of action of the remedy, which is the most important aspect in prescribing. How to see the physiological change that happens when a patient goes through an acute condition. This, the posology, and much, much more. The fevers, the pediatric cases, how much they have troubled us in our practice, and what is the key to instantly relieve a patient in fever. I'll be discussing this and taking you through this whole journey of understanding and managing acute conditions with homeopathy. And in this journey, I really invite you to share, and I can share something which has found effective in my practice. So, friends,